The GCC's telehealth revolution is about to explode, and traditional healthcare systems might not be ready for what's coming. Picture this. A healthcare market worth just $437 million in 2024 is projected to skyrocket to an astounding $2.6 billion by 2033. That's not just growth. That's a complete transformation of how an entire region approaches medical care. But here's where it gets controversial. This 21.9% annual growth rate might actually be too conservative. Telehealth transformation in the Gulf. Breaking down the numbers, the Gulf Cooperation Council's telehealth sector stands at a fascinating crossroads. Current market valuation sits at $437 million as of 2024. But industry experts from IMARC Group anticipate this figure will balloon to $2,595 million within the next decade. The projected compound annual growth rate of 21.9% between 2025 and 2033 represents one of the most aggressive expansion trajectories in global healthcare technology. But wait, there's something most analysts aren't discussing openly. This explosive growth trajectory raises critical questions about healthcare equity and accessibility that deserve serious consideration. Artificial intelligence, the game changer nobody saw coming. The integration of artificial intelligence into Gulf telehealth services is reshaping patient care in ways that seemed impossible just 5 years ago. Remote diagnostic capabilities powered by AI are achieving remarkable accuracy levels, particularly evident in Saudi Arabia's massive healthcare infrastructure overhaul. The kingdom's $50 billion investment has already transformed over 300 healthcare facilities region-wide, creating a new standard for digital medical services. Virtual care platforms across the United Arab Emirates demonstrate how machine learning algorithms can revolutionize patient-doctor interactions. These sophisticated systems have achieved an impressive 85% patient satisfaction rating in virtual consultations, proving that digital healthcare can match and sometimes exceed traditional in-person experiences. Here's the part most people miss. AI-powered chatbots and virtual health assistants are providing round-the-clock patient support, effectively reducing the burden on physical healthcare facilities by a substantial 40%. This transformation is simultaneously improving emergency response capabilities across all GCC nations, while fundamentally changing patient expectations about healthcare accessibility. Chronic disease management through AI-driven remote monitoring represents perhaps the most significant advancement in preventive care. Qatar's national health strategy exemplifies this approach, successfully integrating smart monitoring devices for over 75,000 patients dealing with chronic conditions. These systems continuously track vital signs and health indicators, enabling proactive medical interventions before conditions deteriorate. Predictive analytics are pushing preventive healthcare into previously uncharted territory. Bahrain's innovative AI-enabled screening programs demonstrate remarkable capability, identifying potential health issues 60% earlier than conventional diagnostic methods. This early detection advantage translates directly into improved treatment outcomes and significantly reduced healthcare costs. Market forces driving this healthcare revolution, government investment in digital health infrastructure across the GCC has reached unprecedented levels, creating momentum that traditional healthcare systems struggle to match. Saudi Arabia's Vision 2030 initiative represents the most ambitious healthcare digitization program globally, with over $50 billion allocated specifically for telemedicine platforms and AI-powered diagnostic technologies. The UAE's National Health Strategy 2021 to 2031 prioritizes virtual care delivery, with Dubai Health Authority spearheading comprehensive telehealth service deployment. These governmental initiatives are fostering partnerships with technology leaders, including Microsoft and IBM, positioning the entire region as an emerging digital health powerhouse. But here's where it gets controversial. This rapid digitization might be creating a two-tiered healthcare system that could potentially disadvantage certain population segments. Digital infrastructure advancement throughout GCC healthcare systems is accelerating adoption rates beyond initial projections. Internet penetration rates exceeding 98% in the UAE and 95% in Saudi Arabia, combined with extensive 5G network deployment, enable seamless video consultations and real-time patient monitoring capabilities. Ambitious smart city projects like NEOM in Saudi Arabia and Dubai's Smart City Initiative are embedding telehealth services directly into urban development plans, with expectations of over 2.5 million connected health devices operational by 2030. This technological foundation supports an expanding range of services, from remote surgical consultations to AI-powered mental health interventions, fundamentally altering healthcare delivery paradigms across the region. Demographic challenges and disease prevalence patterns are creating urgent demand for innovative telehealth solutions throughout the GCC. Diabetes affects approximately 18.7% of the UAE's population, while cardiovascular disease rates are climbing by 15% annually across Gulf countries. The COVID-19 pandemic served as an unexpected catalyst, with telehealth consultation volumes surging by an extraordinary 3,800% during 2020 to 2021. Strategic government initiatives, including Saudi Arabia's Seha Virtual Hospital and the UAE's DHA telehealth platform, are expanding specialized medical care access, particularly benefiting rural and remote populations. These programs demonstrate potential cost reductions of approximately 30%, while simultaneously improving patient outcomes through continuous health monitoring and proactive medical management. Market segmentation. Understanding the ecosystem. The GCC telehealth landscape encompasses diverse technological components and service delivery models. Software solutions, hardware infrastructure, and comprehensive service offerings form the foundational component structure supporting this digital healthcare transformation. Communication technologies span video conferencing platforms, mobile health applications, and emerging communication methods that continue evolving with technological advancement. Hosting arrangements divide between cloud-based and web-based solutions versus traditional on-premises installations, with most organizations favoring flexible cloud deployment models. Application categories demonstrate the breadth of telehealth implementation: teleconsultation and telementoring services, medical education and training programs, specialized services including teleradiology, telecardiology, tele-ICU monitoring, telepsychiatry, and teledermatology consultations, plus numerous emerging applications. End-user segments encompass healthcare providers, patients, insurance payers, and additional stakeholder categories, each contributing to the market's dynamic growth trajectory. Geographically, Saudi Arabia, UAE, Qatar, Bahrain, Kuwait, and Oman each present unique market characteristics and adoption patterns, reflecting varying regulatory environments and healthcare infrastructure development levels. Recent developments that could change everything. February 2025 marked a significant milestone when Saudi Arabia's Ministry of Health introduced the National Telehealth Platform, incorporating AI-powered triage systems across 450 healthcare facilities. This implementation reduced patient waiting times by 35% while enabling continuous virtual consultation access for 12 million residents. March 2025 witnessed the UAE's Dubai Health Authority forming a strategic partnership with Microsoft, deploying cloud-based telehealth solutions capable of supporting 500,000 virtual consultations monthly. The integration includes real-time Arabic language processing capabilities, addressing communication barriers that previously limited telehealth adoption among Arabic-speaking populations. June 2025 brought Qatar's Hamad Medical Corporation's implementation of blockchain-secured telehealth record systems, ensuring comprehensive data privacy protection for 2.8 million patients, while facilitating seamless cross-border medical consultations with international hospitals and specialist practitioners. And this is the part most people miss. These developments aren't just technological upgrades. They're fundamentally restructuring how an entire region approaches healthcare delivery and patient relationships. The controversial question everyone's avoiding. While this explosive growth presents incredible opportunities, it also raises uncomfortable questions about healthcare accessibility and digital divides. Are we creating a system where quality healthcare becomes increasingly dependent on technological literacy and digital access? Will traditional healthcare providers become obsolete, or will they find new ways to integrate these technologies meaningfully? What's your take on this digital healthcare revolution? Do you believe AI-powered telehealth represents the future of equitable medical care? Or are we potentially creating new barriers to healthcare access? Share your thoughts and experiences, especially if you've used telehealth services in the GCC region. Has your experience matched these optimistic projections? Or have you encountered challenges that these statistics don't capture? The transformation is happening whether we're ready or not. The real question is, how do we ensure this technological revolution serves everyone, not just those who can afford the latest digital health solutions?